Okay, hello everybody, and welcome to our Hertfordshire Community NHS Trust AGM. And I think for those of you who don't know, I am your new chair, and I've been with you all since the beginning of June. And I'm absolutely delighted to be chairing this today. And I just wanted to start off by saying that I want to pay special tribute to Linda, our outgoing chair, for her many years of service. And I think she brought a humility and a passion and an empathy, which is, an incredible challenge to follow. But I hope to be able to do her work and the board's work justice. So alongside me today, I've got Elliot and on my right, and all our other colleagues in the room. And as I said, it's my first one as chair. So I'm really pleased that many of you have joined us today. And maybe we can now go on to the next slide, please. So as you can see, I won't go through the actual structure, but there are a couple of things I'd just like to highlight. So there's some housekeeping that I'll go into in a minute. There's some thoughts, some early thoughts that I have as your chair, and some highlights from our organisation. We're going to look at our HCT staff in action. And one of the points I'd really like to make here is that we have a massive range of services that we're delivering, and they're not only in Hertfordshire and West Essex, they're much broader than that. And I want to say a special welcome today to our colleagues in other parts of the region. So I might say a little bit about that later on. We're going to talk about the review of the year from Elliot, and I think the other thing that I just want to mention without embarrassing David too much is that this is David's last AGM as Director of Finance, and I want to say a special tribute to David for his integrity, for his ability to support our change and innovations, and for just being an incredibly approachable man to have on our board. So a really big thank you to you, David. So thank you. And then finally, towards the end of today, we'll talk about, we'll have questions and answers. So let me just go on to the next slide on the housekeeping. So as you probably realise, this meeting is being recorded, and a link will go out through all of our channels. To see our annual report for 23-24, the accounts and the minutes from the 23 AGM, we need to go to HCT's YouTube channel and watch the AGM recording from last year, but they will be formally approved in this AGM shortly. Please keep your computer on mute. I'm often the guilty party on this, so I know what it feels to be in that position. You'll notice I've actually got my computer turned off because I don't trust myself. Okay. And there, as I said, there will be a Q&A session at the end. So please do post questions in the meeting and chat as we proceed, and we'll really do our very best to address those later. And so for any questions that aren't addressed today, because sometimes you think of something after we've presented, please email the email address that you'll see there. And your email will be directed to the most appropriate person as a response. So if I just quickly go on to formal matters. So first of all, our declarations of interest. They are all on our intranet site, so anybody can see those. We keep them regularly updated with the help of our governance team, and so please do have a look at those if you want to see other things that we do outside our business here. We need to actually make a formal approval of the 2023 AGM minutes. So as I wasn't here last year, I do need somebody to propose it, and then I'll look hopefully for nods or thumbs up or something to say that we approve them. So do I have somebody to formally make the note of approval?
Yep.
Yeah, Elliot, thank you. And then if I could see hopefully nods and things around.
Yeah.
Anybody want to dissent from that? No, hopefully not. Great, thank you. And then also formally, what is very important in our AGM is to formally adopt our 23-24 annual report and accounts, of which Elliot and David and all the exec team have been really closely involved. So do I have somebody to propose formal adoption and then to approve that? Thank you, David, for proposing that. And do I have approval from everybody? Thank you very much. So I suppose I wanted to just say a little bit about HCT and our vision. And I think this is very embedded in our structures. And I think what's overwhelmingly impressed me about everybody here since I've arrived is their commitment to these values. They are absolutely at the sense and the core of what we're doing. But there is one bit that I just want to highlight, which is inclusion, which is something that we will I know as a board be discussing with everybody over the next year or so, and eventually we'll come to refresh these at some point. But inclusion is absolutely at the heart of everything we do here, and it's one of the values that I really resonate with, and I hope to continue the work that Linda did. It would be very remiss of me not to talk about our community-based healthcare services across Hertfordshire and West Essex and beyond, as I've said. That partnership with social services, with local authorities, with community and voluntary sector is at the very heart of what we are trying to achieve. And it is incredible to think that we have 56 clinical services that we are responsible for across, adults, children and young people. And I just also wanted to say at this point that, we are as strong and do as much in depth in adults, but also in children and young people. And I think it's really important that we recognise that, all of you, both in those two broad areas, some of the specialist services that we're doing, that we should probably talk about a little bit later in some cases, and those of you working outside our, if you like, our original geographical patch, you're all part of us, and we really, really like working with everybody, all of you. And then finally, how can I not say about our mission, our view to want to move from good to outstanding. And every conversation I hear in our organisation is about how do we achieve that? How do we go beyond our last inspection? And I know everybody in the whole exec team, Elliot, everybody are doing a tremendous job in trying to achieve that. So I just wanted to say a few highlights, and please don't be offended if I haven't mentioned you. I think the first thing I just wanted to say is that the Platinum, the HCT accreditation program. Now, I don't pretend to really know all the details of this, and others, particularly Alison, will probably be able to answer all these questions. But what I've been impressed by is the way that it is embedded in our the way that the induction that I attended. It was really at the forefront. So I think that's a fantastic achievement, and and a great credit to those teams that have already gone through this process and the quality wheel. And I'm really excited about this, and I think it's really a really fantastic thing. I wanted also to talk about joined up local care, and the example that we put on the slide is CSACE. One of my very first things that I've done as chair was to go up to Norwich and to talk to some of the CSACE team, and I came away, and I've said this in a presentation that you may already have had, which is that I came away really enthused about the work that the CSACE team are doing. The innovation, the care, the increasing the vaccination rates. It's absolutely at the core of our being as a trust. And I'm really pleased that some of you that were not part of us in the past have joined us, and we look forward to that relationship prospering. And then before I'll move over to Alison briefly, best value through innovation. So how proud should we be that our team, our children and young people's digital team, won an HSJ award for the referral in and the automation, for the referral in and automation to System 1. It's a fantastic achievement. And I think to be recognised for our digital capability and how that can actually improve the way in which we work and we care for our patients, and particularly children and young people, is a fantastic achievement. So well done, especially to you. And then I'm going to hand over to Alison just in 1 second. But the only thing I wanted to say, Alison, is the HCT Shadow Board is one of the things that most intrigued me when I joined HCT. And it is an absolutely fundamental part of what I know we all aspire to, that inclusivity. And so it's an absolute honour to chair the Shadow Board. And I'm really looking forward to seeing how it's going to develop and prosper. But Alison, over to you.
Thank you very much. Good afternoon, everyone. My name is Alison Wilcox, and I'm an occupational therapist, and I currently work as the COVID-19 Rehabilitation Coordinator. I'm a member of the HCT Shadow Board, and I've worked for HCT since 2008. HCT Shadow Board launched actually in October 2022, and everyone in the trust was invited to apply. And having a shadow board in the NHS is quite trailblazing, so we're very proud of this. I'd like to tell you today who makes up the shadow board and some of the work we've been completing in the last year. So the shadow board are a very diverse group of staff spanning both the clinical and corporate teams of the Community Trust and the NHS. We collectively have significant experience and expertise of working in the NHS, and we are very much frontline, so we are very definitely connected to our colleagues and all of our patients. We've got lived experience of disability, term conditions, neurodiversity, being carers, coming from a Black, Asian, or ethnically minoritized background. And so can offer a really wide perspective on items discussed by the Executive Board. The Shadow Board, I think, truly represents the trust, the patients, and the population we serve through our diversity. Our work over the past year has had a significant focus on equality, diversity, and inclusion, EDI, including a focus on recruitment and retention of all of our staff. For example, we had a presentation from the Caribbean and African Health Network on how we can reduce health inequalities and improve well-being. Our local Health Watch completed a presentation on how we can work collaboratively to reach all of our patient groups and to ensure every patient's voice is heard. We've informed the Trust EDI, that's Equality, Diversity, Inclusion analysis of staff, and how we focus on the entire process of recruitment and retention of staff, especially our international recruits. HCT now has a really broad range of support offers, for example, preceptorship, mentoring, workplace adjustments, career conversations, interview training to ensure we have the right systems in place to improve newly recruited staff experience. We are very proud that the Shadow Board has grown in confidence so that honest and helpful conversations can take place both in the Shadow Board meetings and the joint board meetings we have with the Executive Board. This ensures all the diversity of voices are heard to support services and patients, not only in Hertfordshire, but all the other areas we provide services beyond Hertfordshire borders. Thank you for listening and the opportunity to tell you a bit more about the Shadow Board today.
Thank you, Alison, and I think that really highlights the breadth of what the Shadow Board is achieving. And I certainly the meetings and the ones I've chaired have been fantastic. And we're now going to play you a video which highlights some of the great work you do. But I just wanted to say to you before we start playing it that I am so proud of all of the people that are working with us, because the care, the compassion, holding our values so closely comes out in all the conversations that I had. And I don't want to embarrass them, but I spoke to a fairly new recruit who's a healthcare assistant this morning on my way in, and her energy, her passion, her joy at working after 3 months was so just encapsulated what we're about. So I just wanted to say that, but I think I'll let the video now talk. So over to the video. Thank you. Is it just us? So I think we've got a slight problem with sound. We're going to try and rectify it straight away.
My name's Emma Whiteford. I'm the Director of Ops here at HCT. Absolutely thrilled today to be part of the opening of the extension of the minor injuries unit here at Herts and Essex Hospital. It's been a good 18 months in the planning and progressing and building to improve the space here, but we have such amazing staff here. It will really improve the journey for our patients and their families and their carers. We've got an expanded waiting room, and I really think that will help the community that we serve in the locality.
Hi, I'm Emily and I'm a nurse working for the Community and School Aged Immunisation Service. This week is World Immunisation Week. The World Health Organization describes the global vaccine drives of the second half of the 20th century to be one of humanity's greatest achievements. Immunisation has enabled us to eradicate smallpox, nearly defeat polio, and has allowed more of our children to survive and thrive than ever before. Are you and your family up to date with your vaccines?
Since coming back to the Trust at the end of last year, in my new role within CHIS, I've been really struck by the performance levels and professionalism of the team, especially with the backdrop of a transformation and the launch of a new service. They've worked really hard to make sure that that transformation and that launch has gone as smoothly as possible. Whenever issues which are expected have arisen, they've responded with agility and with real tenacity to make sure that that impact wasn't felt by the service.
So under hospital at home, we are dealing with a wide range of patients, including housebound patients, patients with a learning disability, and patients in care homes. And by treating these patients in their own environment, we are avoiding distress and trauma, not to the patient but also to their families.
So the hospital at home scheme is invaluable in supporting patients at home, especially when they've called 999 because they've been unwell. The ambulance crew attend, and if they deem the patient is not an A&E patient, they can ring hospital at home. Hospital at home can bring all the treatment to the patient. The patient feels supported, is treated at home, gets better quicker at home. It's an overall better experience for the patient.
Hello everyone, my name is Doris Mwabo. I came from Nigeria down to UK because of a great opportunity given to me. I'm so happy because of the trust I'm working for. I got a congratulatory note from them after my interview as a Band 6 physiotherapist in the community, and it's been amazing. My life and the life of my family have changed automatically, and we are so happy being here. There is a lot of support from them, the location package, communication, Woody, everybody being together, team, everybody helping out a lot. Lots of training, lots of system one. My horizon have opened since I came down to UK, and I'm happy to be here. I'm happy to be part of the team. I'm happy to be part of HCT. I'm happy with all the packages they are giving, the feedback they get from us. They have reflection over it, and they are doing amazingly well to support more international recruits coming over. That is an amazing thing to do. I'm happy with them. I say thank you for this opportunity. Thank you for giving me this platform. I will not allow it to be in vain. Thank you so much.
My name is Grit Janssens, and I'm here to talk to you about the Workplace Adjustments Passport. I've had to apply to access to work for my hearing and also for my mobility. I have a special system that connects to my hearing aids, which is my Compilot that takes noise that goes in here straight to my hearing aids, and I have a couple of other pieces of equipment.
So my disability is quite new, and I'm still very much coming to terms with it, learning about it, and how I'm living with it.
I defy anybody not to be moved by that and also impressed, and the ingenuity and the passion and the care and the innovation and the drive for achieving the best for our patients is absolutely enshrined in everything that we do. So without further ado, I'm going to hand over to Elliot, who's going to present a review of the year and talk about our future direction. Elliot.
Great, thank you. And lots of things I was going to say were actually already mentioned in the video. So I'll try and make sure that I'll amend as I go through and make sure that I try and edit for things that we've already mentioned. But some of them I might mention again because they're worth mentioning more than once. I think as a trust, we have 4 objectives. We have outstanding quality and performance. We have passion for joined up local care. We want to be a great place to work for everybody that works within HCT, and we want to deliver best value through innovation. We need to make sure, given the state of the public finances, that we make the best use of our resources across the trust. So I'm going to do the review in those 4 sections. Around outstanding quality and performance, we've talked about MIU and the change in MIU at Herts and Essex, and that's really important. About 2 years ago, we welcomed Amanda Pritchard to the trust and took her into effectively what was a broom cupboard at Herts and Essex, where we delivered about a third of the activity in minor injuries that PAH delivered every day, but out of 2 broom, literally out of, I think it was 3 broom cupboards, to be fair, rather than 1. But the expansion there means that we can actually provide a really effective and proper service at Herts and Essex. But it's gone alongside other innovations around the change in the way we've worked with partners over in West Essex around PAH in terms of changing the minor injuries unit there as well, and making that a much more community-based unit rather than focused on the acute trust to keep people out of hospital. The minor injuries unit at Herts and Essex as well, the opening that Emma talked about on the video, it also introduced me to the idea of Prosecco, which is Prosecco without alcohol. We had during the day, so there's always an innovation or 2 around the corner. I've never heard of that before. Alongside that, I think we have a continual commitment to improving the quality of services. We've introduced this year a patient safety framework, which replaces serious incidents and makes them much more a learning experience, much more involving patient complaints and the public and the patients as part of that as well. But whereas I think serious incidents have got into a serious untoward incidents have got into a more sort of where can we attach blame within the organisation, ESERF is much more about how can we take the learning, how can we not just retreat into the normal themes that we would recognise, but really challenge ourselves to learn differently as an organisation, and how do we do some of that reflective practice that will improve services for patients. It's important to say that we've reduced massively waiting lists within HCT at a time when not all parts of the NHS can say that is the case. So in neurodiversity, for example, we've reduced waiting lists by 22% at a time when those waiting lists have gone up by 33% across the NHS. We've done a fabulous push on therapies, children and young people's therapies, to reduce that waiting list by over half and reduce the maximum waiting time by over a year in that service over the last year. So there are other areas as well, paediatric audiology, I could name others as well, but I think it's important to recognise that we have a focus on making sure that we do best practice within our teams to reduce waiting times, but we also seek funding from outside in order to reduce those waiting times appropriately as well. In terms of joined up local care, I will repeat a couple of things on the video. One is about integrated heart failure service. I think that's key to keeping people at home increasingly, and it's a service that we in East and North Herts haven't had when the rest of the country's had it since, I think, 1967 or something like that. So it is a well-known and big hole in our service that I think we've managed to fill this year, which we're really proud about. The Herts West Essex diabetic screening service that we now run across the ICB, which we used to run in South and West, is now has been brought together, and I went to an event where we brought those teams together, and those teams, through a lot of hard work, through a lot of discussion, through a lot of debate, have brought together those teams fabulously to work as one system. We mentioned CSAs and CHIS, school AGMs and CHIS across east of England. I would like to continue to mention our hospital at home service. It was mentioned on there. We have 204 beds in our hospital at home service, which are mostly full most of the time. And Hearts West Essex as a system is the highest provider of hospital at home in any ICS across the country. And we provide most of the beds within the ICS system as well. So I think we can rightly say that we are at the forefront and continue to be at the forefront and continue to want to be at the forefront of hospital at home and what that means for patients and what that means for health services going into the future. We have 204, as I said, on the board. On Tuesday, we got 67 referrals into the service on one day. So this is a service that is continuing to grow, continuing to expand, and I think it's much to the benefit of patients that it continues to do so. Great place to work. I've said it's important to us that people feel valued. Alison's already pointed to some of the things that are discussions that have taken place within the shadow board, which really highlighted that we should do more in the first year or two of people joining the trust to make sure that they stay. It shows that actually we're really good at recruiting people, and we need to become slightly better at keeping hold of them in the first year or two after they join, and that work will continue. But it is worth pointing out, as it is on the slides, that nearly 85% of staff say that they have a understanding and a kind relationship to one another, and it highlights a wider improvement in staff survey. If we look at, it's divided into 9 areas. In 8 of the 9 areas, we improved as a trust in the last year. We are still pretty much the top, I think, if not the top rated trust for team working across the organisation, which I think links back to the percentage on the screen. And we are, I think it's still the only trust that I know of whose clinical quality strategy includes a section about being the best place to work and supporting our staff. And we did that deliberately because we know that one of the biggest things that can affect clinical quality and improve clinical quality is staff feeling engaged, motivated, and wanting to provide good care within an organisation. There is a evidenced and anecdotal link to that we need to reinforce continually and continue to do so. That's why the metrics around staff survey and the work that we do in terms of linking together clinical quality with staff engagement remain so important to us. The BI portal has been mentioned in passing. The important thing about that is that traditionally organisations have looked at HR information, performance information and finance information in 3 different places at 3 different times. And we know that if we're trying to run services, the important thing is if we're not seeing the performance that we want in the services, is that due to a lack of staff? Is that due to a lack of finance? And actually putting those 3 bits of information together and discussing them at the same time, I think has revolutionised our discussion around how we approach problems and how we manage to achieve some of the reduction in waiting times that we've already talked about. If I move on to key achievements, this is where I really will replicate some of the video. Or worth mentioning, the UNICEF Baby Friendly Initiative Gold Award, retained for the 4th year in a row, and really underpins our commitment to quality around babies. The Digital Award, the thing I'll add to that, I think, is that all trusts have clinical information systems that they record all their information on. It's an increasingly anachronistic within the modern world where everybody just organises themselves through apps and web-based. And what this award does is it puts a web front portal that then allows us to write directly into our clinical system. So we can engage patients and the public through a medium that they would recognise in the modern world, the web-based system, but right into our information system. So it's a really fundamental for what we do in the future and can be expanded to other areas as well. I mentioned the Queen's Nurse Award, I want to mention Naomi, who's on the, I think I saw her on the call at one point, so I think he's on the call around her work around safeguarding, and Andrea and Alice for their work around school nursing. I think fabulous that we have so many Queen's Nurse Awards within the organisation. And again, testament to the engagement and to the quality. In terms of future direction, I'll again talk about the 4 areas of strategic direction that we have. Nicholas and I were talking this morning about our continued commitment to as a community trust to keeping people supported at home. We often talk within the NHS, people within the team will know my frustration with this, and we talk about out of hospital strategies and care closer to home. And actually, it's difficult for us in the NHS to sometimes realise that it's normal for people to be at home, more normal than it is for them to be in hospital. And actually, what we need to do is we need to continue to support people to prosper and live well at home in an age where people, because they're living longer, which is fantastic, have to live with more conditions than they used to, and have to live with more problems and chronic conditions and disability than they used to. And I think as an NHS, we need to be at the forefront of saying how we can support those people at home to remain at home, to not be in and out of hospital all the time, which they hate, their families hate, and doesn't make a sustainable service for us as an NHS either. So I think we need to continue to describe how that works in practice in terms of the services that we provide, which I'll come back to in terms of proactive and preventative care in a moment. But it's about reducing harms, making sure that we provide the high quality services to all of those at time we have the timely access, but we also through the quality improvement work make sure that people feel free to make the changes and the amendments that in their services they need to, without having to, as I hear all too often within the NHS, come back to somebody else to ask for approval to do that. They just go, we need to have an attitude that says, you can see that's wrong, we'll just go and fix it and make it better. The direction of travel then that we want to move in terms of preventative and proactive care is to expand our hospital at home, which focuses at the moment on day of admission and referrals on day of admission. As I say, we had 67 on Tuesday, but if we think about that on the right hand side, the acute hospital, and then quite a complex diagram to talk my way through, I'll do it in summary. But it looks at the day of admission and says, what can we do on a day of admission through hospital at home, through admission avoidance, through linking with the ambulance service and making sure that they don't transport to hospital when they can effectively be cared for in their usual place of residence. But we've, through that work, I think, realised 2 important directions of travel that we need to go in. One is about -9, which is the health service still has too much of a focus on, if it goes wrong, we'll call an ambulance, and if the ambulance turns up, then we'll take you to A&E. And increasingly, I think we need to break those system defaults and break those cycles. And I think if we can look at people in the 9 days before they're admitted, I think if we're honest with ourselves, there are a number of times when we could have intervened differently, with earlier antibiotics, with earlier care, with early supported care at home, perhaps through the virtual remote monitoring, but also through the fabulous work our ICTs do all the time, to make sure that people are supported at home rather than continue to deteriorate at the point at which there's no alternative but to admit them. So that's in essence what the -9 is about. There's huge amounts of work that we need to do around using the data that we have available across the system, but also how we refocus services to respond to that challenge. And I think there's a further work beyond that, which is about the proactive care, which is how do we work with GPs, ambulance, mental health services, voluntary sector, social care, to be the glue that holds all of those services together, that allows people to be healthy as they can at home. I know I once heard a famous, repeatedly say that I once went out to an ICT and said, we need to do more work with the voluntary sector. at which someone pulled a great big file out of the drawer and said, these are the 60 organisations or so that we work with on a daily basis, at which, so I now change it to saying, we need to understand as an organisation how we can support the links that we already have with the voluntary sector, expand them, extend them, and make sure that we really provide a holistic response to people with severe disease and severe chronic disease in the community. But we need to do that in conjunction with all of those other groups, GPs, mental health, voluntary sector, social care, in order to do that, which is really the proactive care that we see on the left-hand side of the screen there. So, and if you say all that quickly enough, it sounds really simple. But actually, that is all really complex work that we as an NHS have struggled to cope with. But if we don't get on top of that, I fear that we won't be able to afford the NHS that we currently have, because there is the demographic increase in number of over 85-year-olds. It's going to grow by 40% by 2040. The number of over 65s by a similar proportion. We will not be able to continue to run the health service in the same way that we do now. And I think those two areas are the real areas that we need to focus on. In terms of great place to work, if I can move on, and I'll be brief. I think we need to do more work around young persons network and getting young people involved. We had welcoming Jane Halpin, Chief Executive of the ICB, to Peace Children's Centre yesterday, and we had a fabulous roundtable discussion with a number of the children's leads about how we could link with some of the work that the council does in terms of engaging young people, children across the system. We don't need to invent this for ourselves, because I think we can piggyback on some of that, and how do we really make and hear the voice of young people. We want to continue to develop, as Alison's already said, an inclusive culture, partly through the Shadow Board, but partly also through our discussions and our attitude across the organisation, and improving staff experience in the first 2 years when they join us to make sure that we keep more people. And we'll continue. It's been a difficult financial year, the settlement for 2024-25. Looking forward, I think it will increasingly or continue to be so. I think we need to continue to make sure that we use resources wisely. We make sure that we recruit the right people. We recruit the right people and use them in the most effective way possible across the organisation and all of our resources. But 85% of our resources across the trust are in people, so it's critical that we operate in the best way possible. So I think we have a fabulous base to build from in HCT and in the work that we've done and the innovation that we've done. We need to do more of that and continue to build on that across the system, particularly looking more and more into how we can keep people at home healthy. Thank you.
Thank you, Elliot. And we go over to David to talk us through the finance report for 23 to 24. So,
thank you. So I've got a slide on the year in numbers. Next slide, please. Thank you. So the turnover for the year was 158 million, which is slightly up on the year before. Our surplus for the year at 780,000. Again, slightly ahead of the surplus of the previous year, and I think that's the 14th consecutive year the trust has been in balance or surplus. Staff cost at 115.6 million, slightly up on last year. The agency and bank total at 10.1 million is about £500,000 less than last year. Capital expenditure at 11.4 is a lot more than previous years, and whilst estates, IT and environmental expenditure is the same, a technical change in the way that we account for leases, which I'm not going to go through in detail now because everyone's heard me talk about it before and I could spend the next hour if I had to, means that we now have an additional £6.8 million of capitalised leases that is counted as capital expenditure. Our cash balances at 20.1 million are down from about 28 million last year, but that is just due to the timing of when certain outstanding bills were paid last year and this year. If I move on to the next slide, please. So we have various statutory duties, and this year we have achieved all of them. Last year we didn't fully achieve the Better Payment Practice Code, which is at the bottom of that table, and that one has been a significant improvement over the year. The requirement there is that we achieve 95% of all bills being paid within 30 days, and you can see from the table there that we were comfortably ahead of that at 97.8 and 96.7 for non-NHS and NHS for this year, and that's a significant improvement on the achievement of the year before, and that's a reflection of both the work of the finance team but also the work of the budget holders in terms of processing and clearing invoices for payment. The other 4 statutory duties there we achieved last year and we achieved this year, and that table just sets out what those requirements are, what we achieved, and then there's a reference to the accounts note for those that want to look at that in a bit more detail. And then in terms of the next slide, I started pulling this together when we started with managing the COVID pandemic, and you can see how things have changed. So things like the personal protective equipment, the amount of centrally procured items that we've drawn down and received has reduced significantly now into this last financial year, and the financial value is reduced accordingly. One of the things that we were always concerned about during the COVID pandemic period was the amount of untaken annual leave, and you can see how the COVID pandemic at just over 100,000 was the untaken leave. That peaked at 1.3 million in the 21-22 year, but is down now at 300,000 at almost the same level as pre-pandemic. And our vaccination programme expenditure at 3.2 million is probably I think that is the lowest it's been for since the vaccination programme started. I think last year it was about 6 million. The year before that it was about 25. So that's come down significantly. If I can go on to the next slide, please. In terms of sort of more formal bits, just for completeness, I've included in here the auditor's conclusions on the annual accounts. So the important thing is that the opinion confirms the accounts are true and fair view of the financial position, have been properly prepared and prepared in accordance with the requirements of the National Health Service Act. And if I go to the last slide, please. And that also confirms that there's nothing else that auditors need to bring to the attention of the board from other parts of the annual report that they've looked at. And it also confirms around the value for money position that they've confirmed that the economy, efficiency and effectiveness in its use of resources has been achieved for the year. So that is what I was going to say about the accounts.
Okay, David, I've already said a few words, but I just want to thank you for your financial stewardship and wise counsel, and also to reflect on the great work of your team as well, working with Elliot, because it is a team effort, and I think we will inherit from you that really methodical, carefully considered approach, which has hold us in great stead as an organisation. So a really big thank you from all of us. Thank you. Okay, so we're actually running on time, unbelievably, which means we've got about 10 minutes for questions. So this is when I'm going to need a bit of help. So do we have any online?
I haven't seen any, no.
Okay. Does anybody want to put their hand up and ask anything? We go to the comments, actually. There were a few comments, weren't there? Yeah, and just scroll down if you don't mind. So I don't want to put you on the spot, Paul, but I thought that it was really good to have the bit on the actual video, but also I think that you've drawn out, that we're only as, you know, we have to keep on our toes essentially. And I think that is a really important thing for us all to remember. We can never be complacent. But I think what's impressed me has been the fact that people are not complacent. People are always striving to improve and to achieve excellent for the care that we have. But I think it's good to be reminded that, you know, we have to continue to innovate and you know, keep a very steady ship and be responsive to the needs of all of those that work with us, as well as all our external partners. I've embarrassed you, so I won't say anymore. Any other reflections from the team that maybe people wanted to say?
We could be braver in future years and do a slider. That would get some comments.
Yeah, I know. I was just thinking that.
Nothing brings people out like an anonymous comment. But you know, I think we should. Yeah.
No. Okay.
Do that innovation for next. Save that for next year.
Well, look, you know, if there aren't any questions, you know, that commitment, and I just wanted to say an enormous thank you. I know I said it at our leading lights, but you know, such a big thank you to all of you that are working at HCT, to all of the people behind the scenes that help us to achieve that, to, in my opinion, a really talented senior management and exec team who are leading this, to the shadow board that we've mentioned. And all of this is to achieve the best care possible for our patients and to strive for that innovation. And I think that's a great place to start. And I look forward to reflecting in a year's time when I've done a full cycle, and we'll see where we are then. But thank you to everybody who's taken the time to dial in. And as I said, if anybody is there externally, please, you know, a great thanks from us for listening to us. Thank you.